across. So the ketogenic diet was strengthened. The seizures actually went away on the ketogenic diet, but the child remained severely mentally retarded and was unable to speak or walk. And I felt really bad about that case ever since, and that if we had gotten a diagnosis sooner, that it would have been a better outcome. I've seen a lot of kids with GLUT1 deficiency. The latest few cases have been really quite uneventful. Is that what happens is that you have a child that starts to have what looks like it might be a seizure or something, and then you go ahead and you just sequence all the genes. Forget about thinking about what it might be. You just sequence all 23,000 genes. We find a GLUT1 mutation, put the kid on a ketogenic diet, and that's it. I mean, you don't have to do all the blood testing, all the urine testing. You don't need to do any of the other genetic testing. You just sequence all the genes. No red cell ghosts, no spinal tap, no nothing else. And it also does for all of the other conditions all the other tests, it does all of that and a lot more. So it's really the power of genetic testing. Another case that I've been involved with recently was a little girl who had multiple problems following a vaccination and had very severe autism and seizure disorder and had lost all of her ability to speak. And the genetic testing found a mutation in the sodium 8A, the SCN8A gene, and that confirmed the diagnosis. There's been a lot of cases of sodium 8A that have had vaccine-related problems, and I've actually been involved in that in the vaccine court in Washington. One thing to mention is that, of my 4 own biological children have been fully vaccinated, and I vaccinate my patients. It's just there are rare genetic abnormalities that we can pick up on sequencing many times, which do have a much increased risk for vaccine-related problems. And then in those situations, I want to defer vaccination until they're a little bit older. It's usually the first 2 years is the critical point. So those are just 2 of the many cases. I was going to show you slides, show you pictures and all that sort of thing. The neurodevelopmental disorders goes way beyond epilepsy. The same genes that predispose towards epilepsy also predispose towards migraine headache, depression, intellectual disability, ADHD, autism, you name it. That's because there's not an epilepsy gene, there's not an autism gene. What there are is that these genes make proteins that the nerves need. The nerves need to build a normal brain and to operate the nerves. And if the nerve doesn't have this gene appropriate, making the protein that it needs, the nerve gets into trouble. And what disease will you get when the nerves are in trouble? Well, it depends on all the rest of the genes. It's not just that single change that makes everything. So one person in the family may have ADHD, another person in the family may have epilepsy, somebody else might have migraine. This is very, very common, is that genes do not cause disease. What genes do is that if you have a mutation in a gene, it can predispose towards disease. And what disease that you get, if you get any disease at all, depends on the rest of the genetics and on the environment. Because of this, it's not like you can look at a patient and look at the EEG and determine, it's this pattern and this is the gene to look at. Sometimes we can do that, but those are actually relatively rare. Just 3 years ago, I was the director of Cortigen, which was a life science company, and we did sequencing in humans, and we had panels so that we would do 400 genes associated with epilepsy, or we would do 1,000 genes that were associated with mitochondrial disease, or 1,000 genes that were associated with autism. And these were these large panels that we would do. Now, the problem with those panels, of course, is that every time that there's a new discovery, you'd have to update the panels constantly. And if you do what happens if you have a family that has migraine in one person, depression in another, epilepsy, intellectual disability, etc. You do all the panels. It can get very expensive very quickly, and then, of course, within a couple months, the panel's outdated, and within a year, the panel is totally outdated. So then we moved to whole exome sequencing. In whole exome sequencing, you just don't sequence the 400 or the 1,000 genes. You sequence all 23,000 genes. So there's no need to determine a panel. You just sequence every single gene. And then very lately, costs have come down dramatically for whole genome sequencing. Whole genome sequencing is doing the exome plus all the rest of the DNA. So the rest of the DNA is 50 times larger than the exome, approximately. So the genes are only 2% of the DNA. The rest of it does things. It turns the genes on and off and other stuff. And that's where you can really get a good look at the rest of the DNA. The other thing is that you may have heard about something called a CMA, or a chromosomal microarray, because the sequencing will read the exact genetic sequence. It's like picking out a book and actually reading it letter for letter to see if anything's misspelled. But if a book is missing from the shelf, it's not going to find it. What chromosome microarray does, it looks for large mutations, like thousands or millions of base pairs which are missing or extra. And so it was two completely different technologies. So you do your sequencing, your whole exome sequencing, and then you do your CMA. So whole genome prices have gotten down lower than the two of them together, and they keep on going down. And we hear from Dante Labs, the price has gone markedly down. By far now, the most difficult part is the interpretation. The interpretation is difficult for many reasons. Number one is, and I was a medical director of laboratories for up to 10 years. And no disrespect to the laboratory, but as a laboratory director, you don't know the patient as well as the physician and the family. There's just no way. Even if you get the right medical records, you just don't know the patient as well. And you can't have the doctor who happens to be an expert in that area going through the entire sequence himself or herself. So once the laboratory has done its sequencing and has made its interpretation looking for the really obvious thing, then you really need to find an expert that can take a look at the sequence and find out what else is there. I frequently, in areas of my expertise, which happens to be the neurodevelopmental disorders, and also the functional disorders, chronic pain, chronic fatigue, things like that, I find mutations that are treatable very frequently in sequences that laboratories found as negative, either because they didn't have a full history on the patient, or they just simply, nobody can be an expert in everything. I would never presume to read a cancer sequence because I'm just not an expert in that area. So I'm going to let others speak right now, but I just wanted to mention that sequencing makes a huge difference. It's completely changed the way that I do medical care. I get a sequence first, and then if I get any other tests, it's to confirm what the sequencing might have shown, if that's necessary. It's cheaper, it's faster, and it's better than what we've done in the past. I try to get sequencing on all of my patients, and I'm very happy that the costs have come down so dramatically that this amazing technology is available for everybody. But interpretation is also difficult. If you want to come by my booth later, it's the NeuroNeeds booth. It's on the far right side, about halfway down. I have some flyers there and stuff that can help you to understand how interpretation works with it. So,
hello everyone, I'm Andrea Riposati, CEO of Dante Labs. Dante Labs, we are a whole genome sequencing company specialized on rare diseases. And we started Dante Labs with the mission of making advanced genetics accessible to everyone. And then we also embraced a second mission, which is to leverage genetics for the greater good of society. So moving from the single patients to all the patients together. And before talking about Dante Labs, I would like to tell a story about a woman named Kelly from Wales. Kelly was born with a horrible disease, which was undiagnosed at the time. And so since she was about 5 years old, she'd been suffering from pain, chronic fatigue, and muscle fatigue. And for years, she went to the doctors, and doctors will give her some medication. She will feel better for a couple of weeks, but then she had to go back to the doctor. Then she started trying some genetic testing, and she did panels. And so also she went to the doctor, and then the doctor ordered a panel covering some genes for a specific disease, but these panels always returned negative. And meanwhile, she kept suffering. So Kelly needed help, and Kelly found Dante Labs. we gave Kelly and her doctor the chance to do whole genome sequencing, the test that Dr. Boles just discovered. So we analyzed all the 23,000 genes, as well as the areas between the genes. And from the whole genome sequencing, we found out that Kelly had some variants in genes that are associated to a disease, which is completely off the radar from the diseases that her doctors thought she had. And so when Kelly went back to the hospital, the doctors were able to finally diagnose her precisely and finally give her a precise treatment, which finally enabled her to live a more normal life. And so, as Dr. Boles explained, the difficulty with genome sequencing is that you get a lot of information, and then what you do, you want to go and look at the variants that are compared to the reference genome. And so what we do is that while we analyze the entire genome, then we try to focus the analysis on the specific genes that are interesting for the specific patients. And so, for instance, for the case of epilepsy, for the cases of epilepsy, we look at the genes that Tracy mentioned before, which are actionable, and we can allow people then to find a better treatment together with their doctor. Genetics is powerful not just in the diagnosis, it's also powerful in understanding the reaction to drugs and treatments. Because there are many cases where a drug may not work with a specific patient, not because of the reaction of that drug with the patient in the disease that is trying to cure, but because of some other side effects. And these side effects are also driven by genetics many times. And so there are, for instance, drugs for bone diseases that have a negative reaction to muscles. Although that drug is not intended to cure any muscle disease, then can have a negative reaction because of the genetics of some of the patients. And so what have been the traditional problems with genetics? Mainly two problems. One is that some doctors, unfortunately, do not believe in genetics. At least they do not prescribe genetics as much as they should. And then the second problem is the cost. Traditionally, genetic testing have been extremely expensive, like thousands and thousands of dollars. And as Dr. Boles explained before very precisely, that if you only do a panel and you only look at some genes, then the risk is that after 6 months, there have been new genes and new variants that have been discovered, so that panel, you will basically have to rerun it again, so that previous test has become useless. And this is just to explain, in a very simple way, the differences between the different genetic tests that's available. So panels, they only cover about 0.1% of the DNA, because this is really like few genes. So it's a very small percentage of the DNA. Then there is the whole exome, which is all the genes, but it's still about like 2-3% of the DNA. And then finally there is the whole genome, which is everything in your DNA. So it's 100% of the DNA, including a lot of areas of the DNA that today we don't really know yet what they are for. But the good thing about the whole genome is that once you do it once in your life, then the data really becomes an asset for your life. So even today, if we only know about, let's say, 50 genes connected to epilepsy, then in 5 years, if there are 5 more genes that are discovered, you can go back to your data from whole genome sequencing, and working with a doctor, with a software, you can find if you have variants in those new genes. And what we have done as a company to make whole genome sequencing really accessible to people has been, number one, to lower the price. So bringing the price down from thousands of dollars to only $500, and even less thanks to our partnership with Brad and with the Epilepsy Day. Then what we have done is that we have made sure that people don't have to use needles and get blood. So all our tests are based on saliva. And saliva is an amazing carrier of DNA. So generally speaking, between saliva and blood, they work the same way. But the huge benefit of saliva, of course, is that you don't have to use a needle. Kids don't like needles, but I think adults don't like needles either. There are tubes where people can spit. There are swabs that little kids can use. Also, if there are people that have salivation problems, there are specific swabs for them. So saliva is really like the best way to capture DNA from patients. And then we also made very easy for people from around the world to work with us, because we ship a saliva collection kit to them with like free shipping. And then there is a return label which also provides free shipping that allows us to get the saliva kit back and then to extract the DNA. We had patients even in French Polynesia in the middle of the Pacific Ocean where the shipping was very expensive for us, but it was very rewarding to be able to have someone that does not have a genetic center or a hospital with a genetic machine in his island to get the whole genome sequenced. So this is our website, and this is what I mentioned before. So I don't want to be here like promoting our products, but if you ever go on our website, if you ever order a test, please remember to use the code Epilepsy Day so that you can have a special discount from the standard prices. And so if you looking forward, we think we as a company we're really investing in two areas. The first one is to make the prices go down, so really bringing down prices more and more. And there is really like the chance in a couple of years to have the whole genome sequencing for less than $100. And then the second avenue is to expand the precision of the whole genome sequencing. Number one, mitochondrial DNA, where the whole genome sequencing reads also the mitochondrial DNA, but adding the mitochondrial DNA then provides like even better analysis. And then a second area very promising for rare diseases is long read sequencing, which is expanding the standard whole genome sequencing with these long reads where you can really look at variants and at problems in big parts of the DNA. And there are multiple companies working on long read sequencing like PacBio or Oxford Nanopore, and we feel that's another very promising area for rare diseases. And then if you think as a community, I believe that the end goal of genetics for rare diseases or for epilepsy is then to enable other companies to find cures and treatments that really work well for as many patients as possible in epilepsy. Thank you. And before I leave, this is my email. If you have any questions, tomorrow, you can send me an email.
Can I ask you a question now?
Yes.
Is that okay?
Yeah.
One, I think my wife we just kind of nodded at the same time we're going to do this. Epilepsy is hereditary in my family, and it goes back. Yeah, so far back, you didn't talk about it because you'd either be put in an insane asylum or something else. Is there a way, when you look at data like this, with my daughter who has it too, are there going to be certain things that are, I don't want to say broken, but just mutated? It's the same for me, it's the same for her. If I have my aunt do it, it's the same for her. Like, is there
a comparison to look at all of them together?
so that we know, like, as a family, like, this is exactly what you're going to have?
So there is, but there is also the chance that different people in the family may have different variants in their genes. So there is that definitely. So there is an advantage of doing the analysis, let's say, to the entire family, especially to parents and then kids. But there are many cases where then your parents have a different variant than the kids. But maybe, Professor, if you would like to add something.
It's rare that it's monogenic and that it's a single variant, a single gene. That does happen, but that usually happens disease that occurs early in life and is very, very severe. It's not 100%, but that's often. It's probably there's several variants in your family, and some family members, maybe almost everyone has one of the variants and the other variants are different. So it is likely there's different variants, and it may not be the major variant which is the most treatable. So one approach would be to go ahead and do the person who's most affected, find the variant, and then look at the others. But you may find out that some people with epilepsy in the family don't have that variant. It doesn't mean that that's not what's causing the seizures. It may just be one of the many contributing factors. So it's much more complicated. It takes a geneticist to sit down and go through it and talk to the family.
So when you do order it, like let's say if we did do it for both of us to look at us and our children, because one of the main things is we want to make sure that this baby doesn't necessarily get it, or we're prepared if she has it. do we then have to see a geneticist to have them look at everybody's stuff? Is that how it
Or
works?
do we work with our doctor and have them?
Like, how do you get that analyzed for the whole family?
Well, stay up here because I'm not. There's legal situations which depend on the various jurisdictions. You're going to be sequencing in the United States, right? So it's not up to EU law. It's just
Correct.
American law that we have to worry about, right?
Yes.
Yeah. In the United States, only a physician can order a test like this. And a physician has to interpret the test. That doesn't mean the physician can't say, oh, it's negative, here's the result or something, but it's up to the physician to order the test, and it's up to a physician to give you the information on the test. It's just the type of, I don't know your family, okay, but just based upon, this is more of a general answer. It sounds complex enough that it would require a geneticist to really do a full evaluation. And anything else you say would probably make it more complex. You know what I mean? I've heard enough now to say it's complex.
Okay.
And I can talk to you guys a little bit after just about what we've learned on our journey.
Okay,
Yeah.
thank you.
Yeah, absolutely. Question?
Yeah, so if you identify if somebody has a genetic mutation that is linked to a particular disease, rather than treating symptoms of that disease, is it possible to correct that genetic mutation?
Well, not correct the mutation as to remove the mutation and put another one in there, but a lot of times you can treat that mutation. You can't cure it, but I mean, many times we can treat it. I mean, I gave you an example of a ketogenic diet because ketones can get into brain independent of the glucose transporter. The disease has not gone away. The second you give a normal diet, you're sick again, but it's a way to treat it. There are I have people with epilepsy, autism, mental retardation, and many other things that are due to the creatine transporter as well. They can't get creatine into the brain. And so you give a huge amount of creatine or cyclocreatine to get away with it. A lot of the mitochondrial disorders, what you do is that you can't make the brains make more energy, but that's not what's causing the disease. What's causing the disease is all the pollution that the bad mitochondria are making. The mitochondria are not burning fuel efficiently, and they're producing all this pollution. In a car, it would be smoke. In our bodies, is acids, reactive oxygen species, etc. You can use antioxidants and other things for that. For channelopathies, which are really common in epilepsy, it's probably by far the most common cause of epilepsy. There are specific genes which can block the channels. Usually what happens is that a mutation causes the channel to be leaky. And there are genes that can block that channel to block the leak. So you haven't cured the disease, but you've gotten, that's not just throwing a Band-Aid on the problem. That's actually correcting the problem, at least as long as you're giving the treatment.
And you might be alluding a little bit to gene therapy, this idea that you can go in and actually modulate the nucleotide gene. And this is happening not so much in epilepsy, but it's happening quite a bit in like spinal muscular atrophy, in retinal blindness, certain forms of retinal blindness, where they are actually FDA-approved gene therapy products. They're not perfect, but I'm happy to tell you a little bit more about where to find that information. We don't have that in epilepsy yet. Any other questions? All right, well, our speakers are going to hang out a little bit after, so if you do have any questions, don't hesitate to come up and ask. And thank you guys.